our community of support program. This year, we have in our program over 97 advocacy organizations that have come together to provide social service supports for families. We know that caring for a child with complex healthcare needs is is hard. It's a lot it's a lot different than caring for your typical children. And so we need a lot more supports as well. I am going to share my screen so you can see this. Here at the foundation, our mission is to improve the care experiences of children living with neurologic conditions. And we really do this by making sure that families and medical professionals are connected. And then we also kind of serve as this hub or this collaborative center for education support and care advancement or quality improvement. This program started a couple of years ago, actually, when we were hearing from families that they were just really, really struggling to get supports in place. It could be for medical equipment, it could be help traveling to a clinic appointment, it could be things such as getting respite care. And families were just struggling. And so, as we heard that from families, we were also hearing from clinicians that they saw this need for families as well. They saw that families needed connected to social service supports. They needed connected to other families who are walking a similar journey. But clinicians were telling us, we don't really have time for that. We barely get through in a clinic appointment, the medical side of things, let alone all of the other things that families are dealing with that really can impact them day in and day out. So we said, there's got to be something we can do here. And we started our family support program so that no family, no matter their circumstances, has to go through this journey alone. You can have all the financial support in the world. You can even have all of the medical equipment, transportation, all of that. But it doesn't make it any easier to walk this journey, especially if you're walking it alone. And so we really believe that the mental health of our families as a whole gets better when they walk this journey with someone else. And so that is really key. That is part of our program. Number one, I think, in our program, as well as getting families the social service supports that they need. Here at the foundation, we have three pillars that we stand on. One is that child and family support, which I'm going to talk about today. The other is education, and I'm going to talk about some of our educational tools that we have that might be useful for you, that I've actually used personally for my daughter. And then also some of our research and care advancement. I'm not going to talk about this as much, but just know that this third pillar really is important to us because we want to make sure that we're moving the needle forward, that we are creating systemic change and not just spinning our wheels. So that's really, really important to us. So here's how our family support program works. We have an assistance request form on our website. Families can go ahead and fill that form out. Once they do, we get a notification notifying us that you have made a request. So once you've contacted us, we then have a social worker on staff. She's fantastic. Her name is Vivian. She is bilingual. She speaks English and Spanish, and she picks up the phone and gives you a call. If she can't get a hold of you by phone, she'll text you or email you, depending on whatever contact information you put down. She then gets your story. She learns what it is that you need. A lot of times families will reach out, and as they're telling their story, it's clear that there are more things that could be really beneficial to them and other ways that we could help. So we can find educational resources for you if you don't understand a diagnosis or a medication or whatever that may be. We can find educational resources for you. We can refer you to a local social service organization. So let's say you lost your job, your spouse lost their job, or you're a single parent, and finances are really, really tough for you, and you're just having trouble putting food on the table. We can get you connected to an organization that could help you find that food. Same thing with medical equipment. We do a great job of being able to connect to over 30,000 different organizations in the United States. And we can look both locally or we can look nationally. So if it's something like food, obviously we want to look locally, but if it's something like financial assistance, we can search the entire nation for supports for you. We can also get you connected to another parent who's walking a similar journey. Again, that really that connection is so vitally important to the mental health of families. And we can also refer you to another advocacy organization that might have resources that would help. So, for instance, let's say you're going through some difficulties with school with the IEP process. We could easily refer you to the Pediatric Epilepsy Surgery Alliance. And you might be thinking, Kim, my child has never had epilepsy surgery. And I will say to you, it doesn't matter because their resources and what we know about their resources here at the foundation is that they are incredible no matter, um, what your child's diagnosis is. It really, really gives an extensive look at the different kinds of IEP goals you could write. Or if, you have your OT that's telling you, yeah, they don't qualify anymore. I just don't know what to work with them on. And you can go through there and say, oh, you could work on strengthening, or you could work on emotional regulation. There are lots of things that you could utilize their resource for uh, to help you through that IEP process. So we know kind of, since we sit in the middle of the disability community and have a lot of advocacy partners, we know what resources each one provides, and we're able to connect you to the most appropriate one. And then, if you would like, we also maintain that outreach. So we will reach out to you 30 days, 60 days, 90 days later, just to let you know, hey, we're still here. Has something come up? Is there anything that you need? We're happy to help support you throughout the journey. We did a survey a couple of years back, and families indicated that they go through crisis on average every 60 days. That is a lot. That is not what a typical family goes through. And so we know that it's going to be difficult for you. The first thing you think of is, hey, let me reach out to CNF for support. So we just want to remind you, hey, we're here. And if it happens to be one of those times where you need support, we're going to be here to help you. So these are some of the things that we can help you with. So Vivian, our social worker, can help with mental health services, financial assistance, transportation, education, if there's something you just don't know, or you don't have the capacity to look it up, right? Like it takes a lot of time to find some of these supports. We can do that for you. Employment assistance and so much more. Pretty much anything you could think of that you would need in a day, we can help you with those needs. We also can refer you, as I said, to other advocacy partnerships. Right now, we are at 97 advocacy organizations and growing every single day. And each one of those advocacy organizations helps to provide social service supports for families. Peer support, again, is one of those things where you take for granted, or sometimes you don't want to, you think you don't want to talk to someone else, but it really, really, really does help your mental health. And we've seen that time and time again through our educational programs. It's important to just be connected. Here is some of the educational content that we have. So right now, we are getting ready to launch a large transition of care project, but more actually on the adult side. So what we keep hearing is we have this great clinic in pediatrics, and then when we transitioned over to the adult side, the adult care system, everything was siloed. It was so difficult for my child to get what they need. And so it's frustrating. And people say, well, Kim, you're the Child Neurology Foundation. Why are you focused on adults? And I say to them, because my daughter will be my child in her 30s, in her 40s. It doesn't matter how old she is. She's always going to be my child. So sometimes people look at that and they go, you're only pediatrics. No, we are not. We serve families through the lifespan. We can also help you to understand genetic testing that is a bit that maybe your child had, or maybe if your child hasn't had genetic testing in a couple of years, it's time to have that testing done again because new genes are being found, new treatments are being developed, and so it's really important. And a lot of people don't know that you need to continually have that testing done. We can help you coordinate with your child's care team, manage harmful and disruptive behaviors. That's something we personally deal a lot with. And so that is very near and dear to my heart. Effectively using telehealth services, keeping your child supported at school, healthy epilepsy management, all of that, all of those are topics that we can help you with. As far as our tools and resources go, this is actually one that I used, and let me see. Oh, no, that is the first one. Okay. This is one of the resources I've actually used with my daughter. We have moved or transferred her care from one hospital to the next, and this was really helpful in allowing me to gather my thoughts and see when was the last time we took a certain medication, or we had this symptom or that symptom. And it just really helps you gather your thoughts before going into the appointment when they start drilling you and asking you, when was the last seizure? And, when did this happen or that happen? And it's a lot. And then it's hard to remember, and you don't have, all of the information in front of you to be able to accurately give them that information. We also have a respite care notebook. So let's say you are going, out for a little bit and you have a respite care worker with you. This just gets everyone on the same page. How do I keep my child safe, happy, and healthy while I'm not there and someone is caring for my child? This is our transitions checklist. So if you have a child that is moving from pediatric to adult care, this actually really helps you transition effectively and think about all of the different moving pieces. We actually have recently worked with Epic. I'm not sure if you know what that is, but if you have My Chart or some other medical management tool through your doctor, we have worked with Epic to get this transition checklist into their system so that they can actually send that to you via My Chart. You can fill this out prior to your appointment, and get the support that you need. Maybe you need help with financial planning, but you don't really need help with day programming. Then you can indicate that here and make sure that your transition from pediatric to adult care, you're really getting pointed direction and services where you need them most. Seizure action plan. If you do not have this on file at your child's school or day programming or wherever they are during the day, you need to. This is extremely important. We are really getting the word out right now to schools, school nurses, letting them know that if there is a child in your school that has seizures, we need to have a plan in place. What do we do if the child is having a seizure? So this is a really great document as well. We are actually getting ready to revamp this family support handout currently, but the gist of this is that we send this out to schools, clinicians, patient advocacy groups, anyone and everyone where our families could potentially be, to let them know about our family support program. So if you know of another family who is struggling and really needs some support, it's really easy just to scan the QR code or go to our website, childneurologyfoundation.org/family support, and you can fill out the assistance request form there. We're getting ready to revamp this so that every month we're sending different information out to our families, and I'll go over that here in a minute. A new program that we are starting here this fall in November is actually called Willow and Wind. It is a grief support program that honors both the tenderness of loss and the strength found in remembrance. The willow symbolizes resilience, flexibility, and grace. And the wind represents the forces of change, the unseen currents of memory, emotion, and healing. Together, it really reflects the journey through grief. It's unpredictable, yet survivable, painful, yet filled with moments of quiet strength, love, and transformation. So what we're doing is we're creating a grief community. This grief community is therapeutically rooted and led by a certified counselor. It is going to be inclusive of multiple forms of grief, from child loss to anticipatory grief. If you don't know what that is, it's basically maybe someone in your community has passed and you have grief at the thought of this happening to you. You're already taking on and feeling that grief as if you had already lost your child. It could be grief as if, I thought my life was going to be a certain way for my child, and it isn't. And so you're grieving the loss of what it could have been. And then the grief community is also going to be educational and supportive. So we're going to have resources for families and the broader community. As you can see down below, some of these key components, it's the course. There's going to be an online community. We are going to launch a grief-focused podcast starting in January. And then we're also going to do a component of community education on topics such as SUDEP, sudden unexpected death and epilepsy, and seizure detection devices to raise awareness and promote prevention. With that being said, I will also tell you that sometimes even families who have had a seizure detection device have still lost their child. And so while we're bringing awareness to these things as potential preventative tools, we don't have anything that's foolproof yet. And so we always just keep that in mind. In 2026, we are going to be launching 20 cohorts for a course called the Caregiver's Compass. It is really about how you can conquer stress, grief, emotional isolation while caring for your child with complex healthcare needs and yourself. So it is a self-paced digital course, but we'll have some Zoom components to it so you can still be together in community. There will be evidence-based strategies to help you manage the stress, the grief, the uncertainty in everyday life. We will tackle topics such as trauma, relationships, including those with, your partner, families, extended family, friends, lots of different topics that come up. I will tell you it's going to be an incredibly powerful course. We will give practical tools to help you build resilience, emotional regulation, make sure that you yourself are being taken care of. And then also just connect you to that larger caregiving community, as I talked about before, that is so incredibly vital to our health and well-being. We are also starting our school outreach. So we are really trying to get into those underserved, rural, hard to reach populations and really educate families on the ground. So we will educate them about genetic testing. The AAP just released new guidelines on genetic testing, saying that if you are diagnosed with an intellectual disability, a cognitive disability, basically diagnoses such as autism or some of these umbrella terms like CP or just epilepsy, but you've never had genetic testing, genetic testing actually should be the first thing that is done or recommended by your doctor. So how do you talk to your doctor about that? Also, talking to schools and families about seizure first aid, seizure action plans, and IEP support for both teachers and families. We are also diving into schools because there is a large shortage of professionals in the disability community, and we need to start instilling in this next generation that they can choose careers that impact our community. And so CARE stands for Cultivating Advocacy, Research, and Empathy. It is a student leadership and service program. Students will apply for the program in their sophomore year, and the program will take place in their junior year. It will be innovative, hands-on. We will have experts from a variety of different fields, from genetics to neurosurgery to intervention specialists, and even people who are storytellers in the advocacy space, and giving them the opportunity to see there are lots of ways that you can contribute to science and service in the disability space. So through this program, they will also have an opportunity to get their Congressional Service Award by doing some community service work and interactive workshops. So really cool program, really excited about this as well. So if you know of a school or if you see us starting to promote this, please send it on to students you think might be interested in this program. And then finally, how do you connect with us? There are lots of ways. Sign up for our newsletter. That's one way that you can connect with us. You will get, we send out a monthly newsletter, so we don't bombard you with tons of things. But if you want more regular updates, just connect with us on social media, Facebook, Twitter, Instagram, all of the places. We are there. You can call us anytime. We will respond within 1 business day. You can email us right here. And then as always, you can get to our assistance request form by scanning this QR code here and submit a request through that form that's on our website. We do provide training to social workers as well to leverage this resource. So if you work in the medical field or you know someone who works in the medical field, have them reach out to us. We are happy to provide training on how to get connected to our family support program and refer families to us. So we are always just looking to help. Even when I reach out for sponsorships from people, I say, if you're not willing to sponsor us, please just let people know about our family support program, because we want to help as many people as we can, and we want to take that the isolation away and the stress away just by getting people connected to others. So that is it. What questions do you have for me?